Good morning. So today I will talk about vitamin D deficiency and its extraskeletal effects. So some words about vitamin D. It is a fat-soluble vitamin which is basically stored in the fat. It acts as a hormone precursor. The final hormone, which is a steroid-like hormone, is calcitriol, and it is a neurosteroid, and it is endogenously synthesized from cholesterol, and we can also get it from as a supplement. So it exists in two forms: vitamin D3 and vitamin D2. Uh, Basically, the vitamin D we can get from two sources. Either our skin produces vitamin D when it is exposed to the ultraviolet light, or we can take it from the supplements. So, two forms of vitamin D: vitamin D3 cholecalciferol and vitamin D2 ergocalciferol. These are not active forms. I like these are the prohormones. So, in the liver, they undergo hydroxylation, 25 hydroxylation, and it is converted to calcidol. Then it goes to the kidney where another hydroxylation carries on, and 125 dihydroxy vitamin D3, which is the active form calcitriol. And in the kidney also some of the vitamin D is converted into inactive form. Basically, the physiological functions of vitamin D, apart from the bone health, it has been incorporated into the immune system. It acts as a modulator of the immune system, and it reduces the inflammatory cytokines. So the deficiency can lead to certain autoimmune diseases. Similarly, it also inhibits the abnormal cell growth. And its deficiency may lead to cancers. I will discuss in detail in the later slides. Then some of the it is also have been incorporated in the glucose metabolism, and its deficiency may lead to type 1 or type 2 diabetes. Then it also influences the smooth muscle tone, cardiac myocytes, and controls intracellular calcium. So here the deficiency may lead to some cardiovascular diseases, and it also acts as an antioxidant, and it is a neuroprotective. So deficiency may lead to Alzheimer's and dementia. Then neuromuscular stability, it has been incorporated in the strength of the muscles. So the deficiency may lead to myopathy or weak muscles, especially in the elderly persons. There had been one study carried on in Middle East from June 2021 to 2022. It showed that about 74.3% of the patients were absolutely deficient of vitamin D, and another 21% had insufficient vitamin D. So only 4.5% of the patients had a normal vitamin D. So we can see that how prevalent the vitamin D deficiency is. A few symptoms of vitamin D deficiency, which may lead to high blood pressure, some digestive problems, obviously joint and bone pains. Patient may feel fatigue, depressive thoughts, and dry skin, and as deficiency may lead to immune impairment. If we talk about the causes of vitamin D deficiency can be there because of lack of in the diet. If we are taking diet not sufficient in vitamin D, then it can lead to the deficiency. Then obviously malabsorption, gastric bypass patients, because enough vitamin D is not absorbed. Then small bowel disease, or if the skin is not exposed to the sunlight, so the endogenous production will not be there. And use of the sunscreen, because sunscreen blocks the ultraviolet light, so skin can't synthesize vitamin D. And darkly pigmented skin, which also hinders ultraviolet light, so the vitamin D can't be produced. Then defective 25 hydroxylation. Even if the vitamin D is produced by the skin, if there is some liver disease, the 25 hydroxylation will not be there. It may also lead to similarly the kidney failure, because there is also another hydroxylation taking place. So kidney and liver disease obviously lead to vitamin D deficiency. And then nephrotic syndrome, because the vitamin D binding protein is lost. And certain medications may increase the catabolism of vitamin D, like anti-seizure medication, phenytoin. And finally, the defective target organ. There is vitamin D resistance, and so that leads to the vitamin D resistant rickets. So if we talk about sources of vitamin D, the rich source in the diet is cod liver oil. and we can get it from the sunlight, eggs, raw milk, mushroom, and certain type of fatty fish. They also contain vitamin D. So, if we talk about the numbers of vitamin D in a certain food, the cod liver oil, 1 tablespoon, basically 15 ml, is the richest source for vitamin D. It contains 1,360, while our daily requirement of for the young patients, young people, it falls around 600, and for the older individuals, it is 800. So 15 ml of cod liver oil provides enough vitamin D. Apart from that, salmon, mackerel, these are all fatty fish which contains vitamin D. And then fortified milk, egg yolk contains a small amount of vitamin D, and fortified cereals also contains vitamin D. So if we talk about vitamin D from the sunlight, basically it depends upon the area of the body exposed to the sun and the skin color. Basically, if the skin is darkly pigmented, less vitamin D will be produced, and if a person has a more body fat, then also the less vitamin D will be produced. So if we talk about how much exposure it should be 5 to 30 minutes of sunlight, and maximum chances of the vitamin D production is between 10 a.m. to 3 p.m. So we can guess that why vitamin D is more deficient, and we can't get it from the sunlight in the Middle East area because of the extreme of the weather. So for vitamin D production, there should be full body exposed to the sun, which is not possible here. And if we talk about how much vitamin D is produced, if a light skinned person is exposed to the sunlight and it produces light pinkiness, then it produces 10,000 to 25,000 international units of vitamin D in a single exposure. Uh, that vitamin D has been categorized into three as per the levels. One is sufficient vitamin D, one is insufficient, and one is vitamin D deficiency. So vitamin D, if a person is having greater than 30 nanogram per ml, it is sufficient vitamin D. Between 20 to 30, it is insufficient, and vitamin D deficiency is below 20, which is also categorized into mild, moderate, and severe. Why it is so? Because if I will talk later about the extraskeletal health, the most of the extraskeletal symptoms are related to absolute deficiency, which is below 20. So recommended daily allowance is 600 international units in adults 19 to 50 years. At above 50 years, it is 800. And if person is obese, we need to take more. And if person is having malabsorption, so that also needs a higher dosage. If we talk about the forms D2 and D3, if we take vitamin D3, which is cholecalciferol, it increases vitamin D more than the vitamin D2. There are two types of formulations in the market about vitamin D. For deficiency, we usually give 50,000 of units once weekly for 8 weeks. If for vitamin D, if we compare the daily dosing to the weekly dosing increases more vitamin D as compared to the daily dosing. Why this is so? Because if we take the daily doses, some of the vitamin D is not absorbed. So that leads to the lesser vitamin D in the body. And for the children, it is also same 50,000 for weekly for 8 weeks, and after that we can go on to the daily recommended allowance, and that will maintain sufficient vitamin D. So we will talk about extraskeletal effects. Vitamin D has been widely spoken about in the risk that deficiency may lead to the risk of cancer. It increases the risk of infections, autoimmune diseases, neurodegenerative disorders, and there has been some studies which showed that there are adverse pregnancy outcomes. And the cardiovascular diseases are more when vitamin D is in the lower range. So these all studies showed that if a person is having vitamin D in the insufficient range, the chances are not there. But when a person is having vitamin D in the deficiency phase, then the chances of getting these are more. So if we talk about muscle function, some studies have shown that if vitamin D is less than 10, it leads to the muscle weakness in older individuals. And in that study, it was shown that the risk of fall in the older individual was more when their vitamin D was below 10 nanogram per ml. And if we talk about cancer, it has been seen that the risk of colon cancer and breast cancer in post-menopausal women is more when they are absolutely deficient in vitamin D. No consistent evidence was found for prostate cancer, but if a person is having vitamin D around 10 nanogram, the risk of colon cancer and breast cancer in postmenopausal women is more. Some studies in the premenopausal woman didn't show any association of vitamin D with the breast cancer. And also the vitamin D, if we give the higher doses of vitamin D in the patients in the cancer patients of colon cancer or the prostate and the breast cancer, the vitamin D supplementation didn't show any role in the treatment. Uh, Vitamin D acts as a modulator of the immune system. It activates dendritic cells, and it also inactivates the acquired immune system. So, deficiency of vitamin D may lead to the activation of the acquired immune system. That may lead to certain autoimmune diseases like multiple sclerosis, inflammatory bowel disease, and type 1 diabetes. And some studies have shown that the risk of multiple sclerosis is more when a person is absolutely deficient in vitamin D. And regarding allergic diseases like asthma, the studies were not convincing that the vitamin D deficiency has been associated with asthma. Regarding infections, there was one study carried out in India which showed that vitamin D supplementation in smear positive tuberculosis patient leads to rapid clearance of sputum. But the final outcome, or it didn't help in the prevention or the treatment of tuberculosis. But yes, the bacteria was cleared early from the sputum, which is supported by the vitamin D role in the immune system. If vitamin D is sufficient, it strengthens the immune system. So that's why the clearance of bacteria from the sputum was more. And vitamin D deficiency has been absolutely seen in COPD exacerbations. And the persons with COPD, when they were given higher doses of vitamin D, that lead to lower COPD exacerbations. Then, if we talk about cardiovascular system, vitamin D has been associated with the increased risk. There were meta-analysis of 19 studies which was done, which showed that lower vitamin D leads to the higher risk of cardiovascular diseases. These studies also showed that the mortality was also high when a person is having a low vitamin D. Uh, if we talk about diabetes, type 1 diabetes has been associated with vitamin D deficiency. So the children who were having diabetes, type 1 diabetes, were shown to have vitamin D deficiency in their childhood. And these studies have been shown that the early supplementation in infancy leads to the lesser chances of getting diabetes. And it was shown that it was approximately 30%, which is a significant number. If we talk about type 2 diabetes, it is seen that the pre-diabetes risk has been reduced with vitamin D supplementation. Because in type 2 diabetes, basically we see the metabolic syndrome, like the person is obese, overweight, and obese and overweight person is more prone to have vitamin D deficiency because of the higher requirements. If we see the body weight, more fat cells, because the fat cells store vitamin D, and if they are exposed to the sun, their skin will not produce that vitamin D as compared to the thin individual. So they are mostly like deficient in vitamin D, and we have seen that the obesity also leads to the metabolic syndrome and diabetes, type 2 diabetes mellitus. So multiple studies had been carried out, and it was seen that the individual with pre-diabetes, vitamin D may reduce the risk of progression to type 2 diabetes when the vitamin D levels were maintained in those persons. Vitamin D receptors are there in the brain. So, and one alpha hydroxylation is also expressed in the human brain. So, vitamin D plays an important role in the development of the human brain. So, it has been seen that the vitamin D deficiency is found in the persons with Alzheimer's disease. It may lead to schizophrenia and depression. If we talk about pregnancy outcomes, many studies have been done, and it has been shown that the poor maternal vitamin D is associated with adverse pregnancy outcomes like gestational diabetes, preeclampsia, and small for gestational age infants. If we talk about offspring, the children were followed up to the age of 10 and 20 years, and it has been seen that the if the maternal low vitamin D was associated with poor bone health at the age of 20 years. So maintaining vitamin D in the mother is important for the well-being of the child also. And but there were some studies which were carried out about autism and ADHD, and it was seen that there was no association of vitamin D deficiency with these diseases. And last slide, genetic polymorphism. Genetic polymorphism is basically how the genes of a person reacts to certain substances. If we talk about vitamin D, genetic polymorphism related to vitamin D defines vitamin D effects in every individual, its absorption, its metabolism, and every person has different genetic makeup. So the vitamin D in every person reacts differently. We have seen that the same person with same levels of vitamin D, they have different symptoms. So the genetic polymorphism defines that, it shows that if two persons are exposed to the sun in the similar the circumstances, their skin and they have the same skin color, but they can produce a different amount of vitamin D when they are exposed to the sunlight. And in them, the same level of vitamin D can express different symptoms. So genetic polymorphism is definitely there in vitamin D deficiency and its manifestations. So a certain patients may have certain diseases at the same level of vitamin D, and the other may not have that. That is explained by basically the genetic polymorphism. So the bone health, diabetes, cardiovascular diseases, and cancer at the same level of vitamin D, maybe the risk of one person is more because of genetic polymorphism, and the other person may have maybe having less chances of getting that. And also, genetic polymorphism defines the absorption of vitamin D also and its metabolism from the GI tract. If two persons are given the similar amount of vitamin D supplementation, their vitamin D levels may differ. That is also defined by the genetic polymorphism, and it has been seen that we are giving vitamin D supplements to certain patients, and their vitamin D is not in the required range, as compared to the other person. The vitamin D supplementation make their vitamin D in the sufficient range, although the both of them don't have any malabsorption or any GI diseases. So the genetic polymorphism should also be kept in mind when we are treating vitamin D deficient patient. So the conclusion is vitamin D is an important vitamin, and apart from the bone health, it has been incorporated in many extraskeletal effects. So its deficiency may lead to some autoimmune diseases, some sort of cancers, and certain metabolic diseases like diabetes and certain CNS disorders. Although this is not a direct link if we say that vitamin D deficiency will absolutely lead to that, but definitely this is one of the factors which should be kept in mind. And regarding screening, the guidelines are very limited about the screening of persons with vitamin D, like if a person is not exposed to the sunlight, or elderly individual who are institutionalized, or a person is having malabsorption disorder. But I think in the Middle East region, or in our region, in our practice, we have seen that more than 95% are deficient in vitamin D. So if we see certain non-specific symptoms of myalgia, fatigue, bone pain, there is no harm of doing vitamin D. And we have seen that that the persons coming with these non-specific symptoms, when they were given vitamin D supplements, their symptoms improved. So we can like screen these patients, although it is not there in the guidelines, but in our clinical practice we can screen these patients for vitamin D. Okay, thank you.